Neonatal mortality rate also increased from 1.2% in the half year of 2022 to 3.6% during the same period 2023. It means when our children are born, within the first 28 days, they die.
It used to be the fight against maternal mortality, but now it is neonatal mortality. The current neonatal mortality rate of 3.6% of every 1,000 live births is attributed to the non-availability of functional neonatal intensive care units at the various health facilities across the region. Currently, the supposed regional hospital, Rara Government Hospital, has only one functioning incubator and a baby warmer to take care of newly born babies with health complications. Dr. Jose Kufuafre is the Oti Regional Director for Health. He has been speaking at the 2023 half-year performance review meeting.
One of our challenging areas, as you are mentioning, is high neonatal deaths that we have seen this year, which is very, very worrying, with many of the deaths occurring within the first 5 to 7 days after the babies have been born. And our analysis have shown that we don't have proper neonatal intensive care units, or which we call NICU. We don't even have incubators in the region to be able to incubate or help babies who are premature and they are born.
He is appealing for support to remedy the situation.
So we are pleading that we need NICU. At least 2 or 3 or 4 of our hospitals should have a very functional NICU with all the equipment, the infant warmers, the incubators, and a few other gadgets that will really help. But the region needs an ultra-modern neonatal intensive care unit to help manage the neonates.
Also affecting quality health service delivery in the region is the non-availability of regional medical store. The Oti region continues to depend on the Volta region for its critical medical supplies. But how is this affecting quality health delivery in the region? Dr. Afre explains.
Unfortunately for us, we don't have a medical stores, and we are still relying on the Volta regional medical stores. And you all know the distance from Oti to the Volta. Imagine somebody crossing the Oti River with a pontoon all the way from Ketekrachi, going all the way to Volta region to get medicines. We have a system we call the last mile distribution, but unfortunately, even though it's working, we are not able to get all the medicines that we need. So the availability of medicines to manage all our health conditions is becoming a challenge.
Mrs. Eva Mensah is the Director, Nursing and Midwifery for Ghana Health Service and a parent to the Oti region. She says the departure by health workers for greener pastures is worrying and affecting health delivery, although figures are yet to be collated on the numbers that have left so far.
We are losing nurses for greener pastures, and currently midwives have also joined to the diaspora for better conditions of service, I would say. International markets is looking for experienced nurses. They are looking for nurses who have specialties. So those who are going mainly are experienced, they have specialties. Some of them are as high as principal nursing officers. Some of them are even deputy directors, and they are leaving for greener pastures. So it is worrying. I wouldn't say we have data on its effects now. What I can say is that it's really affecting health service delivery.
Also affecting quality health delivery in the Oti region is the continuous absence of a secondary referral facility in the region. Peter Sanu for Joy News.